We'll run through the bones of the body that you need to know for the lab. And we'll start off with the axial skeleton bones to begin with. So the axial skeleton here can be found on this particular skeleton, everything in green. Everything in the tan color there is a appendicular skeletal bone. So we're going to concentrate right now on everything in green there. You also need to know the individual structures that we can see on the skull as well. And so each bone has its set of markings that we can find. And so above the orbit here, we have the supraorbital foramen. And then below the orbit, you have the infraorbital foramen. So two structures there. On the mandible, you can see it from this view, but we'll go over the mandible by itself. We have the mental foramen right in there. Inside the orbit, we then have structures that can be seen here as well. And so we have the inferior nasal concha, and we can just barely see the middle nasal concha there. And then in addition to those two, we then also have the vomer. And so that's going to be that right there. As we move on to a lateral view, we can see a lot of the same things. We can still see the frontal bone and the zygomatic bone and nasal bone, the mandible, the maxilla as well. And so all those same structures are there to be relatively easily seen. But now we have some new structures here as well. And so we had the frontal bone here. We now have the parietal bone. We have the temporal bone. We have the occipital bone that can be seen. In between the parietal bone and the frontal bone, we have this little suture here. And so this is the coronal or the frontal suture. We then have in between the parietal bone and the temporal bone, we have another suture here. This is the squamous suture. And then in between the parietal bone and the occipital bone, we then have the lambdoid suture, sometimes lambdoidal and squamosal as well for those two there. So we have those structures that we can see on there. We can also see a few structures here on the temporal bone. And so this big bump here is the mastoid process. This is what we can feel just behind our ear. If we were to stick our finger in the ear, we would be going into this hole here. And so this is our external auditory acoustic meatus or canal that is there. And then just in front of there, we then have the styloid process. And so that whole structure there sticking down is the styloid process. On the occipital bone, this little bump that is here is the external occipital protuberance. And so we can see that there also. So biggest hole there in the skull is our foramen magnum. From there we have some other smaller holes. This one here is just a depression, essentially what it looks like anyway. This is the jugular foramen. We then have in front of it the carotid canal. And keep in mind that all of these structures are found both on both sides, so they are left and right structures that we're going to see them there. We then see this structure here. This is our foramen lacerum. We then have foramen ovale. And then we have this small little hole here, foramen spinosum. And so all those three are found relatively easy there. The carotid canal is actually going to, as it makes its way through the canal itself, so it's not a foramen, it's an actual canal. It actually runs this way, and it's going to open up to the inside of the skull in the foramen lacerum. So we'll see it there inside the skull as well. Other structures that we can still see here, we still have the mastoid process. We can see a little bit of the styloid process there as well on the inferior view. On the interior view, we'll find many of those same structures that we just saw. So here's foramen magnum again. Here's our foramen lacerum, foramen ovale, and then foramen spinosum. So we can see all of those relatively easy at this point as well. Some things become a little bit more difficult just because of the placement that they are in inside the skull and the way that the picture has been taken. So things aren't exactly tilted per se the way that they should be in order to be able to see them the best on this particular picture. So the jugular foramen is actually part of that shadow that is there. The internal acoustic meatus is that opening there, and that can be seen on either side. We have the ethmoid bone. So there's the entire ethmoid bone itself. The holes in the space there that we have are foramen inside the cribriform plate. So the actual structure there is the cribriform plate, all of the tiny little holes there. This other larger structure here is the crista galli, and so that sticks up from the cribriform plate. This is where all of your nerves for smell are going to be coming from the nasal cavity up into the skull. We then have the sphenoid bone, right in here. And this portion of the sphenoid bone is the lesser wing. And then down here we have the greater wing. So it's actually two different portions to the bone itself. And so the lesser wing is kind of on top and it's smaller. The greater wing is on bottom and it's much larger as far as the structures there go. For the mandible, we have some structures that we can see on the mandible itself as well. And so we saw the mental foramen before. So we have that mental foramen there. From there we have a condyle, and so a rounded articular surface here, and that we have the mandibular condyle on either side. This is what's going to make up the temporomandibular joint. So that's the mandibular portion of the joint itself. We then have the mandibular angle. We have the mandibular notch. And then the structure here that sticks up is a process. And so this is the coronoid process. And so this is an attachment point for muscles as well for chewing. The bottom picture there of the mandible has been cut in half. So the mandible has been cut in half so that we can see kind of the inner part of the jaw. And that allows us to see then a foramen here. And so this is the mandibular foramen. The mandibular foramen has arteries and veins and nerves that run through it. And that nerve that goes through there comes in and gives up innervation to all the teeth. And so that's why if you have a single tooth that is numbed, so they come in with the Novocaine there, all of the innervation that is coming up to that point is going to be blocked. So everything this way becomes numb. Everything this way still fires off their action potentials and gets it to go. And so that's one of the principles in terms of reducing pain during dentistry, is that at least on the mandible, you can knock out the majority of the jaw and not have any kind of pain in it. Also the same reason why that same nerve pops out of the mental foramen and ends up making your cheek and your lip and kind of the chin and everything all kind of numb in that area as well. A closer look at the orbit, we can now see what's inside there. And so one large foramen, we have the optic foramen. This is where the optic nerve is going to exit. We then have two fissures. The first is the superior orbital fissure, and then the second is the inferior orbital fissure. The superior orbital fissure and the optic foramen both go back into the interior of the skull. The inferior orbital fissure drops down and goes this way. So if we were to put a pipe cleaner in there, we wouldn't actually see it come out on the inside of the skull. The remainder of the axial skeleton is the vertebral column and the thoracic cage. And so the vertebral column we have here, we've got 7 cervicals, 12 thoracics, 5 lumbars, and then the sacrum and the coccyx. They all have their own distinct characteristics. And those two arches are the posterior arch and the anterior arch. And so we have the posterior arch here, the anterior arch here. All cervicals have in common transverse foramen. So there is a hole in the transverse foramen that can be found there. And then from there, we have a little facet here on that anterior arch. And this little flat spot, this little facet that's there, that is the facet for the dens. And so that's where the dens, which is on the axis, is going to articulate. So here we can see the dens of the axis, and it's articulating here with the facet there for the dens itself. The axis then has basically everything else that we would normally expect to see on a vertebrae. And so with the exception of essentially having the atlas's body there with the dens, everything else is the same. So it has a spinous process. It has transverse processes with their transverse foramen. It has a superior articular process and facet, the facet being the flat spot and the process being the whole structure that's there. It also then has inferior articular processes and facets. We have the vertebral foramen that can be seen there as well. A typical cervical vertebrae, so from C3 down to C7, we have all of the normal typical structures. So we have a spinous process. We have a transverse process. We see those transverse foramen again. We have the body of the vertebrae. We have the vertebral foramen. And then we have two other structures that we can now see here. We have this whole region right in here is the lamina, and this little region in here is the pedicle. And so we have an extra little bar of bone there that we can see very easily on the cervical vertebrae. But again, the hallmark of cervical vertebrae are those transverse foramen. Thoracics, again, we basically have all the same structures. And so we've got a spinous process sticking out the back there. We've got transverse processes coming out the side. We've got a body. We can see the pedicle and the lamina. Lamina is a little bit difficult to see. It's kind of in that shadow there. We have the superior articular process and facet, the inferior articular process and facet. On this one down here, it's a little bit easier to see the facet, the whole flat spot that's there. This one here is the whole triangle, in a sense, is the superior articular process, and then just the flat portion is the facet that we see on there. So since this is the thoracic region has something that no other area has, and that is the rib cage. And so since we have the rib cage, we need to have a place for those ribs to articulate. And so on this particular thoracic vertebrae, we have demifacets, and so a superior articular demifacet and an inferior demifacet there. And then there are also transverse articular facets or costal facets that are there as well. And so the rib comes in and it touches all three of those points on that one. On others, it just has a single costal facet here, and then a transverse facet out here. And this one again has two, one here, one here. And if you look at all of the vertebrae here as well, these are all thoracic, but they have tremendously different shapes. And so the top ones here being closer to those of the cervical, so this is like T1. This one here being somewhere in the middle, this is like T7. and then this one here being more like T12. And so here at the top, T1, they have to be able to articulate with the cervicals. In the middles, they can be just kind of like regular plain old thoracics. And then at the bottom, they have to be similar to those of lumbars, once again. And so the shape changes quite a bit. But the common theme is that they all have facets on the body for the ribs, as well as on the transverse processes. So we're always going to see those on the thoracics. From there we have lumbars. Lumbars are your truly typical vertebrae. And so they again have a body. They have a transverse process. A spinous process. A transverse process to them. We have the lamina. We have the pedicle. We have the superior articular process, and then the facet, just that space in there. The inferior articular process, and just the facet there. We have the vertebral foramen. And then this one here is stacked so that we can actually see the intervertebral foramen. So the intervertebral foramen is the opening that's going to be on the side when we stack two or more vertebrae together. So we have to have at least two together to be able to see that intervertebral foramen. But that's common for all levels, once again, cervical, thoracic, and lumbar. So lumbars are the prototypical, typical vertebrae. Nothing else is really different about them. And then we have the sacrum and the coccyx. We'll start with the coccyx, and the coccyx, basically, you just need to know the coccyx. You just need to be able to recognize what it is and be able to name it. For the sacrum, we do have a couple of other structures to see here. And so we do have a superior articular process and facet once again on there. We have a ridge here that runs along the back here. And so this used to be all of the spinous processes of the sacral vertebrae, but since they fused now, we now have what's called the median sacral crest. And so that runs right along the center there. We have posterior sacral foramen. We have the auricular surface. This is where the sacrum is going to articulate with the pelvis. On the anterior view, we can see the anterior sacral foramen on there. We have the sacral ala, the wings sticking out the sides. And then we have what essentially amounts to the body, or the sacral promontory. And so that's sitting on the top there. The sternum, we now have part of our thoracic cage, and the sternum is divided into three portions. We have the manubrium, the body, and the xiphoid process. So three different portions there. We can see here where these little scalloped out portions here are where the ribs are going to articulate with the sternum itself. So the ribs themselves have a head. They have the body of the rib. And as you come out towards the end of the rib, you can see that it almost looks like it's just been chopped off. And that's because, remember, the ribs have hyaline cartilage that attaches the rib itself to the hyaline cartilage and then eventually to the sternum that's there. We then also have the tubercle, little bump there. So the head's going to articulate with the bodies of the vertebrae, and the tubercle is going to articulate with the transverse process. And next time we'll talk about the appendicular skeleton.